If you've heard of lupus but aren't exactly sure what it is, or if you've been experiencing unexplained symptoms and wondering whether lupus could be a possibility, this video is for you. Lupus is one of the most complex autoimmune diseases we see in rheumatology. It can affect many different parts of the body, and the symptoms can vary enormously from person to person. This is one reason lupus can sometimes be difficult to recognize early on. In this video, I'm going to explain what lupus is, the symptoms you should never ignore, how it is diagnosed, and the treatments available. I'm Dr Naveen Bhadauria, consultant rheumatologist at Pure Rheumatology in London. Let's start with the basics. What is lupus? Lupus, also known as systemic lupus erythematosus or SLE, is an autoimmune disease. This means the immune system becomes overactive and mistakenly attacks the body's own tissues. Unlike conditions that affect just one area of the body, lupus could potentially affect multiple organs and systems. This includes joints, skin, kidneys, blood cells, lungs, heart, nervous system. Not everyone with lupus experiences all of these problems, but lupus is considered a systemic autoimmune disease because it can affect the whole body. Now, one important thing to understand is that lupus symptoms can fluctuate. Patients often describe periods where symptoms are worse, known as flares, and other periods where symptoms are more controlled. Now let's talk about some of the key symptoms. One of the most common symptoms is fatigue. This is often profound and can be extremely frustrating for patients. People with lupus frequently describe feeling exhausted even after sleeping. This is not simply being tired after a busy day. It is a deep physical and mental exhaustion that can affect work, concentration, and quality of life. Another very common symptom is joint pain and stiffness. Many patients with lupus experience pain affecting the hands, wrists, knees, or other joints. The joints may feel stiff in the morning and improve gradually through the day. Unlike some forms of arthritis, lupus-related joint inflammation does not usually cause severe joint damage, but the symptoms can still be very significant. Skin symptoms are another important feature of lupus. One of the most recognized rashes is the butterfly-shaped rash across the cheeks and nose. This is often referred to as a malar rash. However, not everyone develops this classic appearance. Some patients develop rashes triggered by sunlight. This is known as photosensitivity. Patients may notice that exposure to sunlight worsens their skin symptoms or overall fatigue. Hair loss can also occur in lupus. Some people notice thinning of the hair during flares. Mouth ulcers are another common symptom. These are often painless and may come and go. Raynaud's phenomenon is also frequently associated with lupus. This is where the fingers or toes change color in response to cold temperatures or stress. The fingers may turn white, blue, or red and can feel numb or painful. Another important symptom is chest pain or shortness of breath. Lupus can sometimes cause inflammation around the lining of the lungs or heart. Patients may notice pain when taking deep breaths in. Now, lupus can also affect the kidneys. This is known as lupus nephritis. Sometimes kidney involvement causes obvious symptoms, but sometimes it may only be detected through blood or urine tests. This is why regular monitoring is important in lupus. Now, another challenge with lupus is that symptoms can be quite non-specific. Fatigue, joint pain, rashes, and headaches can all occur in many different conditions. This is one reason diagnosis can sometimes take time. Patients often tell me they felt unwell for months or even years before getting answers. Now, who gets lupus? Lupus is more common in women, particularly younger women, although it can affect men as well. It often develops between the ages of 15 and 45, but it can occur at any age. Now, an important question patients ask is what causes lupus? The exact cause is not fully understood. We believe it involves a combination of genetic factors, immune system abnormalities, environmental triggers. Certain infections, hormonal influences, and sunlight exposure may contribute in some individuals. Stress may also worsen symptoms or trigger flares in some patients. Now, how is lupus diagnosed? This is one of the most important parts of the discussion. There is no single test that confirms lupus in every case. Diagnosis is based on a combination of symptoms, examination findings, blood tests, and urine tests. Blood tests may look for inflammation and certain antibodies associated with lupus. One commonly discussed test is the ANA test, or anti-nuclear antibody test. Many patients with lupus have a positive ANA. However, it's important to understand that a positive ANA does not automatically mean someone has lupus. Many healthy individuals can also have a positive ANA. This is why blood tests must always be interpreted in the context of the overall clinical picture. Sometimes additional antibody tests are performed depending on symptoms. Urine tests are also important because they help assess kidney involvement. Now let's talk about treatment. The good news is that treatments for lupus have improved significantly. Treatment depends on which organs are affected, symptom severity, overall disease activity. For milder lupus, treatments may include medications such as hydroxychloroquine. Hydroxychloroquine is commonly used in lupus and can help reduce flares and control symptoms. For more significant inflammation, steroid medications may sometimes be needed. Some patients require immunosuppressive medications to control the immune system more effectively. The aim of treatment is to reduce inflammation, control symptoms, prevent organ damage, and improve quality of life. Lifestyle factors are also important. Patients are often advised to manage stress, prioritize sleep, maintain regular exercise, avoid smoking, and use sun protection. Sunlight can worsen lupus symptoms in some patients, so protecting the skin is very important. Now, one thing I always emphasize is that lupus varies enormously between individuals. Some people have relatively mild disease, others may have more complex involvement. This is why personalized assessment and monitoring are so important. Now, another important topic is emotional well-being. Living with an unpredictable autoimmune disease can be emotionally difficult. Patients may struggle with fatigue, uncertainty, and invisible symptoms that others cannot see. Support, education, and good medical care are all important parts of management. Now, when should you seek medical advice? It's worth seeking assessment if you are experiencing combinations of fatigue, joint pain, rashes, photosensitivity, mouth ulcers, Raynaud's, unexplained symptoms that persist, particularly if symptoms are affecting your quality of life. Early recognition and treatment can make a major difference. Now let's summarize the key points. Lupus is a systemic autoimmune disease that can affect many different parts of the body. Common symptoms include fatigue, joint pain, skin rashes, photosensitivity, mouth ulcers, and Raynaud's phenomenon. Symptoms can fluctuate and may sometimes be difficult to recognize. Diagnosis involves looking at the overall clinical picture together with blood and urine tests. The good news is that effective treatments are available and many patients with lupus can achieve good disease control with the right management. If you found this video helpful, make sure to subscribe for more content on joint health and autoimmune disease. And if you're concerned about your symptoms or would like a specialist assessment, I see patients at Pure Rheumatology London. Details are in the description below. Thank you for watching.